Hello everybody, welcome to the Tuesday edition of Video Clips. We are freezing here in Columbus, Ohio. It's like the frozen tundra of Ohio right now, so I hope some of you are in a warmer climate and enjoying yourselves. Anyway, just a couple of quick announcements. Tonight, Ask the Expert at 9 p.m. Dr. Lana Contos is going to interview a physician, a therapist, and a master herbalist and ask them questions. Then you can chime in and ask questions too. And don't forget, in just a couple short weeks, advanced study begins on Tuesday, February 4th, and then on the 25th from 9 to 11 p.m. We're going to talk about whole rethinking the science of nutrition. I'm going to give you slides and materials to keep so that you won't have to take notes fast and furious when you're listening to the lectures. And it's interactive. You get a chance to ask questions. So if you're interested in those things, contact our office. All right, I have two things I want to talk about today. And the first one is more information on useless DEXA scans. A new study adds to the body of evidence showing that testing for bone mineral density is a fairly useless exercise. Doctors, and now thanks to the Affordable Care Act, an increasing number of insurance companies are really reminding, encouraging, I would add harassing women and men actually to have DEXA scans in their 40s and then to get retested frequently. Medicare reimburses for a scan every 2 years, and the average interval between scans is right now 2.2 years. So this study showed that having a second scan within 4 years of the first one didn't do any better in helping to predict who was and was not likely to be at risk for hip or other osteoporotic fracture. And this confirms what a lot of health authorities, including our own U.S. Preventive Services Task Force, have said for years. DEXA scans don't tell doctors or their patients who is and who is not likely to suffer a fracture. In other words, the test is useless. Now, this study included men and women from the Framingham osteoporosis study. They were an average of 74.8 years old. There was 9.6 years of follow-up, little details here, and there were some people who had fractures. But the point is that when these people were retested, it didn't predict who. The results of that test did not predict which people were going to have the fractures. And so the researchers wrote, and this is a direct quote, "The second bone mineral density measure resulted in a small proportion of individuals reclassified as a high risk of hip or major osteoporotic fracture, and it's unclear whether this reclassification justifies the current U.S. practice of performing serial bone mineral density tests at 2.2-year intervals." Now, this information, it's the usual thing, doesn't dissuade doctors and health professionals from doing what they're used to doing. It doesn't matter how ineffective or harmful the tests and treatments prove to be. So just by way of example, Dr. Robert Recker, president of the Osteoporosis Foundation, did an interview with Medscape and said the testing is necessary because patients taking osteoporosis drugs often don't gain mass and often lose mass. In other words, not only is the test useless, but the drug used to treat the unreliable results of the test is useless. But we keep doing these useless things whether they're useless or not. So let's just summarize where we are. And I honestly don't think you can make stuff up like this. Most health authorities have determined that DEXA scans are useless. We do them anyway. This study shows that follow-up DEXA scans after the first scan are useless. But according to the guy who's president of the Osteoporosis Foundation, we need to do them anyway. The drugs used to treat the patients diagnosed with, as a result of the unreliable test, are useless and harmful and sometimes result in worsening of the condition. But we prescribe them anyway. Follow-up tests are needed to identify the people who aren't benefiting from the treatment that doesn't work, and I mean, you just can't make this stuff up, all right? So this is why patients have to learn to just say no. You hear me talking about that more and more. We just have to clean this up at the consumer level so that consumers are making different choices. Now on to some more useless stuff. Most new members of the Wellness Forum are taking supplements when they begin their journey with us, and some are taking a lot of them. I've had people come in with an 8.5 by 11 sheet like this, single space typed with supplements that they're taking. And this is expensive. It can cost several hundred, and I've even seen some over $1,000 a month. Now, some people will say, well, I feel a little bit better because I take this or that supplement. Some are experiencing side effects, but they don't equate the side effects that they're experiencing with the supplements. Nobody's ever told them that supplements have side effects. And in 17 years, I have yet to meet the first person who recovered their health and resolved a health condition strictly by just taking supplements. But they continue to be recommended by health professionals, a group of whom I've started to call the holistic pharmacist. I'll continue writing about discussing this until we get to the place where people are much more cautious about taking supplements. Now, a new study shows that in postmenopausal women with high cholesterol, taking calcium supplements resulted in both increased cholesterol levels and increased carotid intima media thickness. In other words, the supplements are causing disease. So the women were randomized. They took either vitamin D and calcium together, or a placebo. And the authors concluded that supplements should be prescribed with caution in postmenopausal women with high cholesterol. But postmenopausal women are actually the target group for prescribing and recommending calcium supplements. And it's based on the erroneous notion that many people still hang on to, that more calcium is always better for building bones, and that more is needed as women age, and men, to prevent or reverse osteoporosis, the diagnosis of which is also always meaningless, almost always meaningless. See the article right before this one. So calcium supplements remain a big business, but with little proven benefit and more studies showing harm all the time. Avoid them. I can't remember anybody I've had in here who I could recommend a calcium supplement to. Now, calcium is not the only useless supplement. Another recent study showed that vitamin D supplements did not reduce the risk of upper respiratory infections in adults. Researchers gave these adults, who were between the ages of 45 and 75, vitamin D, calcium, or both, or placebo. No differences between the groups in the risk for upper respiratory infections or flu-like symptoms such as sore throat, cough, muscle aches, or headaches. This was the case even for participants who had low vitamin D levels at the beginning of the study. No one benefited. And as if that isn't good enough, the study also stated that flu vaccine provided no significant benefit, but we keep doing it anyway. Supplements are often useless, they're often harmful, they're expensive. Stopping them can improve health. It also frees up money to spend on good food. And I guess the take-home point from all of this today is stay away from things that are not effective, and find out what's effective and what's not effective before you consent to any type of treatment. And believe me, taking supplements is a form of treatment. They can be just as harmful as drugs and cause just as many problems. All right, that's all for today. As usual, feel free to pass this on to anybody who should watch it, and I will speak with you all again on Thursday.